Go to line number 4. Game order to the president of the RNUNL. That's the Registered Nurses Union of Newfoundland and Labrador. That's Yvette Coffey. Good morning, Yvette. You're on the air.
Morning, Paddy.
Let's talk about travel agency nurses again, because we've discussed the issue regarding their rate of pay and the flexibility of schedule, but now it's the whole issue of them being offered overtime versus your members, whether they be on the casual list or the permanent list. What's happening?
Well, that's what's happening in some situations. Totally unacceptable. We have a collective agreement, and when we say a collective agreement, we mean there's parties who sign that collective agreement. One being the employer with government, and the other is Registered Nurses Union. And there is no excuse, rhyme, or reason for them not to be abiding by our collective agreement. We have clauses in there around overtime, about bargaining unit work, and they need to be following our collective agreement.
What does it say specifically? Is it as simple as overtime must be offered to our members before anyone else, or what does it actually say?
Well, it actually says bargaining unit work is to be done by our bargaining unit members in, roundabout way, fundamentally, and that overtime is to be shared. And the other part of this, Paddy, is it's not fiscally prudent. Why would you pay someone who's already getting $100 an hour at double time when you can go with the cheaper option, which is more fiscally responsible, which would be our casual members, part-time members, and then our permanent full-time people?
Yeah, just for context, the numbers we're talking about, the travel agency nurses over the course of 12 months cost $18.4 million versus the nurses that are currently employed, $4.1 million. So there's a major fiscal question to be asked. And hopefully
I really believe the Auditor General should be looking into all this. This is our taxpayer money that's being spent on these private agencies, and it is eroding our healthcare system. And, we're still losing registered nurses and nurse practitioners out of the public healthcare system because they see better money, better working conditions, more flexibility.
Yeah, I don't really understand how that would be the go-to measure when we talk about the monies we already spend in healthcare, upwards of $4 billion for a population around 535,000 people. It just doesn't add up. Yvette, might some of this be happening because, well, we've talked about these numbers of vacancies inside registered nursing, that the work-life balance and the commitment for these extended shifts and overtime and lack of flexibility, and maybe, just maybe, so many of the casual nurses in particular were declining some of these overtime shifts. And so the supervisors or the management inside NL Health Services said, well, if they're going to keep turning it down, we're going to offer it to the travel agency nurses. Do you think that's part of it?
Listen, at the end of the day, I'm not there at that point in time. But from what we're hearing, we have grievances filed outstanding that our members were not offered the shift.
And so those 18 grievances are all about overtime offerings?
Yep.
And what does it look like inside a group or policy grievance? Is that simply about not adhering to the collective bargaining clauses that you mentioned?
Yes, it is. Yeah, that's about it's about violating our collective agreement.
Do we have any idea just how many travel agency nurses there are today and what those numbers have grown, looks like, over, say, the last 12 months?
Well, we do know that the money being spent has doubled, or not quadrupled, over the past 2 years since they introduced the agency nurses in Central Health. I do know from our board members on RNU that are actually frontline nurses and nurse practitioners that they're seen in the workplaces now where they would never have dreamed that they would see agency nurses, such as inpatient units at the Health Sciences Centre. The money that's being spent on agency nurses, it just amazes me because, the government has been working on retention and recruitment. They have offered incentive bonuses for long-term care, for, licensed practical nurses, PCAs, registered nurses, nurse practitioners. They have offered incentive bonus for nurse practitioners to work in family care teams. And while we have registered nurse practitioners out there working in primary care, because their team is not called a family care team, they're not being offered that incentive bonus. But they're doing the same. They're looking after the patients as primary care providers, the same as those that are working in the family care team. It just boggles my mind how you wouldn't invest in the people that are already working in the system and instead opt to go with this private contract for virtual care from nurse practitioners and physicians.
How quickly can these grievances be heard?
Not very quickly. The grievance arbitration process usually takes some time, but we have been successful in resolving some of these already. These are just some that are outstanding as of today.
I want to get you to react to a quote coming from the NL Health Services Director of Recruitment, Education and Culture, that's Colette Smith. She says, when a decision is being made operationally on the unit level, it is likely that if an agency nurse is available to provide immediate care, then they may be approached to work at that moment. It's not meant to be a practice that we support on a routine basis, but no doubt I'm sure that has happened. What I'd like to say to the union and to the nurses out there is that that the care you provide is valued and it certainly is meant to and intended that we would support you first and foremost.
Well, actions speak louder than words. And if you want to show respect to a registered nurse, you give them the option for that overtime, the ones that are in our bargaining unit, not a private agency.
I appreciate the time this morning, Yvette. Anything else you'd like to say?
I guess you saw the news yesterday about the private company that was hired to go in and provide the influenza vaccination in the Confederation building.
Yep.
Another thing that boggles my mind, that's our bargaining unit work. We have public health nurses, registered nurses, LPNs, licensed practical nurses here in the St. John's metro area that could have been asked to go in and do a clinic there. They're doing clinics all over the city as we speak. And the other option was that the people in the Confederation building, like every other citizen of Newfoundland and Labrador, could have booked themselves into one of the clinics under the publicly funded healthcare system.
Yeah, can you get those at a pharmacy as well? I think you can, right?
Yeah, you can walk into a pharmacy as well.
Yep.
Which are, we do have a big population that needs to be vaccinated. But for a government who says that they oppose privatization of healthcare and are fully supportive of the public funded healthcare system, it certainly sends a mixed message.
Then you add in PhoneMed 811 and Teladoc and the Compass Group and all the rest of it. The corporate involvement in the public healthcare system has grown exponentially over the last 20-plus years, and it all really started to change when the free trade agreement was signed with the United States and Mexico. It just changed some of the regulations and the opportunity for corporate, not only corporate Canada, but international, multinational companies. They got involved here, and they're here to stay by the look of it. Good to have you on the show, Yvette. Appreciate the time.
All right. Thank you, Paddy. Have a good day.
You too. Bye-bye.
Bye.
That's Yvette Coffey. She's the president of the Registered Nurses Union of Newfoundland and Labrador. Let's take a break.